And so now we're approaching our final session, but this is one that is not to be missed because it's really going to bring together science, art, emotion, and recovery. And it is all about the healing power of music. Ladies and gentlemen, please welcome to the stage Sasha McLeod, the co-founder and managing director of Creative Health Therapies, music therapist Kristal Foster, and we have a very special treat today. All the way from Boston in the United States, joining us today is Joy Allen, the chair of the Berklee College of Music, who will be moderating this discussion. Welcome, ladies. I'm sorry, no. A massive, yes, Dr. Stephen's with us. Fantastic, Stephen Grobmyer. Ladies and gentlemen,
nice
chair of the Cancer Institute at Fatima bint Mubarak Center is also with us on this panel. I want the loudest round of applause for this panel, please. Yes. And there is going to be a special announcement. I will leave it up to you. Over to you, Joy.
Lovely. Thank you so much, and thank you for everyone for joining us. Thank you to my panelists. Dr. Grobmyer, I'm going to start with you. Thank you for making the time to come here today. We know that research in cancer care shows how music activates emotion, it activates the reward pathways, releases dopamine, endorphins, things that impact our pain perception, reduce anxiety, improve treatment tolerance. So, as the head at the Cleveland Clinic working in oncology, which of these outcomes is most compelling in terms of integrating music-based approaches into care in this region?
Well, first of all, thank you for inviting me to speak and be part of this esteemed panel. Goes without saying that being diagnosed with cancer and going through cancer treatment becomes, for most people, the most stressful thing they've ever dealt with.
Yeah.
And as professionals who've committed their life to the treatment of patients, we've recognized, all of us, how difficult the treatments can be on patients. Not only the stress of a diagnosis, but also the impact that treatment has on patients. And that includes depression, insomnia, anxiety, pain. Traditionally, what was done was if a patient had these symptoms, you would give them another medicine. But I think there's a growing recognition, and we certainly are trying actively to incorporate more music into the care we provide patients. Examples of that would include, for instance, during radiation therapy, patients are able to select the type of music they would want to listen to so they don't have to listen to the loud machine during that time. We've partnered with like the Berklee School, Abu Dhabi Arts, and others to bring music programs to our patients. And there's actually in the hospital now a piano player that is there to support the patients. And I think from our standpoint, it's all of these things. It's all the things that you mentioned, stress, anxiety, insomnia, depression, pain management, are all critically important. And I agree, there is a growing recognition of the impact that music therapy can have on the biology, including there's some evidence now that music improves natural killer cell function, which is a very important part of immunotherapy that we believe has a staying power to cure cancer. Also can reduce cortisol levels, reduce stress, and have many benefits. So thank you for the question.
I have one more follow-up to that. So speaking of those benefits and knowing from the research, we also have some research showing the economic impact of decreased medication, better outcomes in terms of treatment tolerance. How do we move from evidence and economic rationale to actually embedding these innovations into oncology within the region?
Excellent question. And at the end of the day, it's how we approach most new opportunities. It's through collaboration. We're also, as a cancer center, an academic cancer center, committed to study the work that we do. And in order to do that, particularly in a space of like music therapy, it's critical that we have partnerships with people who know how to quantitate the delivery of music and the outcomes that we can apply to our patients. And I think through those type of partnerships, we have the greatest opportunity.
Wonderful. I'm going to move to you, Sasha. So Sasha, a lot of the work you do is within the neurosciences and working with individuals with neurological conditions.
Yeah.
Can you explain a little bit about all of the decades of research that shows how music drives neuroplasticity, cortical remapping, strengthening the neuropathways after stroke and TBI, and even getting into autism and dementia as well?
Yes, thank you for having me, and great question. And it's a privilege to sit with our doctor here, Kristal. Right, neurologic techniques, that's what I train in on top of being a music therapist. It's the way of packaging the techniques that you learn and train as a music therapist, but now you apply the neurological science to it and the data and the outcomes. So, for example, we work a lot with balance, a lot with gait. What other difficulties that transpire? With TBIs, traumatic brain injuries, a lot of the presentations is difficulty walking with balance, gait. So all of the techniques we do specifically measure, assess, and we measure, and we focus towards the clinical goal. So whatever clinical goal, say doctor may have here, we work towards the same goal. So you may find in the UK where I've trained, multidisciplinary teams, and you have different therapists, physio, OT, in the same room, and we're all working towards one goal, but we're all there for different functions, different needs, we're looking at different things. So the physiotherapist will look at maybe that adductor or abductor, the movement with the hip difficulty. The music therapist will be looking to see maybe the speed of how quickly they can move their foot towards an instrument or back, or if they kind of engage with something. With dementia and all the neurological conditions, music is something that recalls memory recall. The way I see that it works, well, let me stop there. The evidence is already there. It's not what I say. The evidence has been done. We have MRIs now. We have an MRI machine where you have a picture of the brain, one where the brain is at rest, and one picture, MRI scan image, where the person is listening to music. The brain where the person is listening to music, you can see areas of the brain that are literally lit up on the MRI scan. And that shows activity. That shows every place that music has activated the brain, has activated a neurological pathway that can activate a different way of working.
So give us a more concrete example. Let's focus in on gait, for example. There was just a great study actually released yesterday that showed rhythm and gait and what happens. So can you tell us, let's say you have someone who has been impacted by a stroke, and how you might go about using the rhythm and music to work on gait.
Yeah. So I refer back to UK. That's where most of my experience is. I'm working in a hospital for traumatic brain injury. You would most likely, a lot of the times, firstly, you always assess. You always assess the patient. You always assess their diagnosis. You always see who is working with the patient, what goals they have already. And then you connect with the patient. You design a treatment package. So, for example, gait. We would work by assessing how they mobilize with their walking aid first. So when someone's had a traumatic brain injury, it's funny because it's not just their walking you're looking at how they move with their walking aid. So a lot of these people have to use a stick, or they have to use a rollator. So as a music therapist, you're looking at the distance, the cadence of how they move, and also the walking aid. So this is maybe their feet. This is a metronome. I'm clicking because we use metronome to help keep a steady pace, to help activate the space in the sound that helps between the step. So when you walk and your foot raises, right? And you put it down. That's 3 beats. Step, up, walking stick, step, up. So I'm getting looks here, but this is what we do. So it sounds quite scientific and a bit boring, but it's effective and it's measurable. So that's how music therapists, neurologic music therapists, can work towards the same assessments, can have joint practice and joint action.
Wonderful. We're going to switch even and go back in time a little bit to birth and think about the neonatal intensive care unit, another area where there is a wealth of research and knowledge and practice in working, using music as a benefit within this space. So Kristal, as someone who's been working in pediatrics for quite some time practicing, we know through the research that music therapy regulates heart rate, breathing, and feeding, and imaging studies show strengthened brain connectivity. How does that show up in your daily work with medically fragile infants or premature infants?
Yeah, thanks for the question, and thanks again to all the organizers for inviting us here to share a bit about music therapy and the impacts of music. The impacts of music therapy in the NICU show up daily. NICU work is so fast. They go from not being able to tolerate any stimulation to being released out into this loud and busy world. So from the moment that that child is born and enters the NICU, music therapy can be really effective, especially when supporting parents who don't know what to do. They feel very stressed and anxious visiting their new baby. And great techniques in music therapy are pairing music therapy with other relaxation techniques or maybe music with guided imagery to help those parents relax, reduce their anxiety before they may visit their infant, so they can step into that space feeling a bit more peaceful and ready to engage whatever way might be appropriate for their gestational age. Some other ways, when music maybe becomes more involved with the premature infant, it's always keeping it simple, but a lot of infant-directed singing, where we use melody within a very limited tones or notes to provide auditory stimulation to help, like Sasha said, start activating their brain and activating those neural pathways to help them start to tolerate stimulation as they continue to grow. And those singing techniques and the volume, very important, the frequency of the notes, all very important. We can then bring the parents in, teach them those skills to then initiate a lot of parent-infant bonding, just to help better prepare them to enter our loud and busy world.
Thank you. I'm going to go back to you, Dr. Grobmyer. You, from the Cleveland Clinic in the United States, has one of the largest arts and health programs, largest music medicine and music therapy programs worldwide. And it also has shown with the research there at that Cleveland Clinic about the impact on health system burden, staff burnout, but also supporting prevention and population health in general. Where do you see the greatest opportunities for Abu Dhabi and this region to really globally position music as a public health tool for prevention and community resilience?
Great question, and I know, especially within the last year, there's been a big push within the greater ecosystem of Abu Dhabi and the UAE to focus on health and well-being. Yeah. And I think music therapy can have a big part in that, in the way patients perceive their own well-being. Yeah. We've also learned there's a big demand for music therapy and different aspects of people's life. We have, for instance, a patient family advisory council that has a big say in how we design new programs. And one of the universal things we hear when we bring up the idea of music therapy is how important this is for patients. Mm-hmm. Other studies have shown that if you ask patients whether they want music as part of their recovery, 90% of patients will say yes. And there's resounding interest in having the patients select their own music. So I think the burden is on us to give the patients what they're asking for. and then to measure and show to the world what impact this type of a collaboration can have.
Thank you. We have a rapid fire 1 minute and 14 seconds. I do want to share that we are very pleased to announce that Berklee College of Music is going to be driving workforce development in this space, and starting with a globally relevant, regionally relevant certificate program that will allow people from this region to study music therapy and to work collaboratively with our partners here to advance not only the research, but also the clinical training, so that the work that is being done is not only leading in the world, but also culturally relevant and specific to this region. Along with that, we're happy to announce that starting next year, we will be having a global innovation challenge in this space, because one of the greatest opportunities is to drive innovation and investment, but also the economic growth in this area. And again, I think all of our panelists have really highlighted so well. I kept hearing the words collaboration. Working together to advance what it is that we know, and we hope everyone will join us and be a big part of that. So please thank panelists for joining us today and taking time from the work that you were doing, and we look forward to continue to working together in this area. Thank you.
Thank you.